I'm Dr. Matt Siracusa here with Green Dental Care. Dental implants are kind of the modern miracle of modern dentistry. That's probably my favorite procedure to do for patients. We're able to restore your missing teeth and chewing function and natural smile in a much more permanent, efficient manner than old school dentures and bridges. And there's some main factors that make dental implants superior than other procedures like dentures or bridges. One big factor is that they help maintain the actual bone in your jaw and your face. They also restore chewing function to similar to natural teeth. The biggest benefit compared to like a bridge, we don't have to go drilling on or potentially damaging neighboring teeth in order to fill that space or restore that tooth. Generally, about dental implants, I mean, 9 times out of 10, we're talking about replacing like single teeth. So we're able to place that titanium screw that functions as a man-made tooth root that permanently anchors a tooth. So it's not something you're gonna have to take in and out or have to fidget with much. And again, the biggest benefit from implants versus dentures is that it completely restores your chewing ability. With dentures, you lose a lot of your chewing function and chewing force, and dentures ultimately lead to bone loss, whereas implants maintain the bone and keep your facial structure and chewing force. One of the, I think, more intimidating aspects of a dental implant is the concept that we're putting a titanium post or screw into your jawbone. The interesting thing is, though, is that there's not a lot of nerve tissue in your bone. So compared to a lot of other procedures like extractions, root canals, dental implants are relatively pain-free by comparison. There's obviously some soreness associated with the actual surgery, but if you've gone through the extraction portion, usually a significantly less painful procedure than that. It's a typical recovery for having a dental implant placed is, you're probably gonna have like peak pain, discomforts, bruising, swelling after about 48 hours. From there, everything kind of starts to peter off. And typically after we place the implant, I want to see you back 2 weeks from the date of the surgery, just to evaluate how everything's healing, remove any sutures we may have placed, and just make sure you're doing okay. Typical good candidate for good dental implants is someone who's a healthy adult, has good quality bone, where we can actually place the implant. One big factor is being a non-smoker. Another big factor is not being a diabetic. Just making sure that you're healthy and have good quality bone. I just recently finished up a what we call like a snap-in denture case, 2 weeks ago actually. We basically took this patient from having to have all of her teeth extracted to having complete snap-in dentures. She had to go through a period of time while she was healing of wearing traditional dentures, and transition to where she now has full snap-in dentures, so the dentures don't move on her. She's able to chew normally. She has her smile back and her confidence back, and she's been really grateful for the treatment. I mean, so if you're dealing with missing teeth, or you don't like your smile because of missing teeth, or you feel like your chewing functions diminished, first step would be giving us a call, getting a consult set up. We're going to have you come in. We're going to take a 3D X-ray to evaluate your bone, make sure that you're a good candidate for us to be able to place the implants, make sure that you're healthy enough to have the implants, and then we can go from there.